It is quite understandable to this audience that neurons in the brain or spinal cord are in minority. We have much more higher in number glial cells and endothelial cells. But however, the role of endothelial cells in influencing injury process is still not very well known.
So the development of a unified strategy came by examining, and that's what I'm going to show, from our data, the general mechanism of decay, which is accepted by, in any field of tissue decay, pathology, from pathology and treatment, the CNS do the degenerative diseases, and for data from other labs.
On the other hand, we can use this increased permeability to apply drugs in a very non-invasive way by the bloodstream, and that's why we call this limited time of increased permeability the therapeutic window.
But a question, a point that I would like to raise at the beginning is this one. This is a very typical, I think still, approach from many researchers and physicians too. So in the peripheral nerves, the fibers regenerate, while in the white matter, so in the central nervous system, the fibers do not degenerate, spontaneously do not degenerate. I think also semantically this is not a correct approach, because we know from the literature, from research and also from the clinics that the true approach is this one. So in the PNS we have regeneration, spontaneous regeneration, much more than in the CNS, but almost never completely, as we see in the patient where recovery is only sometimes satisfactory and many times, especially for severe lesion.
And I want to say only one thing clearly, so when I've said that, you can go to sleep for the rest of the talk. And the one thing I want to say, the one idea I want to put forward, it's only a hypothesis, but I firmly believe it like religion, that spinal injury is not a problem of nerve cells, it's a problem of glia. And if that was the only thing, that's what I want to get across. And let me say first that spinal cord is an injury, and living things respond to injury by growth.
It is how to all knowledge to be tested at the human level, because we cannot tailor our model. We need to convert as much as possible with all information. And here I'm showing from Professor Kakulas from Australia, the specimen was found for injury, as you can see. And what is important in this right side illustration, that this person before dying was ambulatory. So this kind of structure was able to control motion.
Okay, spinal networks. In humans, we've heard from Dr. Dimitrijevic a lot about locomotor, but that number interneuronal networks that can be engaged at various levels according to the inputs that they receive.
Most interestingly is that if you block the receptor of either interleukin-8 or TNF-alpha, the outcome is exactly the same. You shut down all the neuroinflammatory cytokines and there is no production of them anymore. So really it means that you either touched interleukin-1 or 8 or TNF-alpha and all the cytokines are reduced. And if you cover the first week, you have a quite good restoration of activity.
We have published about all the published reports on neuroprotection and all the tentatives to make better the outcomes in spinal cord injury in spinal cord in autumn of 2009.
When we see a knowledge subject just performing a gait in a room, we are not acquainted to associate this movement to intelligence, because it's so common in animal and in human life to see people working around.
I'll show you these. with the slides, one of the first things we've got to do is I think we must increase blood flow to the cord during the healing process. The reason bones don't take so long to heal is because there's not sufficient bone. I think after the injury, as the weeks and months go by, we must put more blood into that area for healing. You don't heal if you don't have sufficient blood flow.
An example of a stochastic resonance comes from subthreshold subthreshold tactile, the perception of subthreshold tactile stimuli. In the first slot, subthreshold signals with minimal noise does not attain a threshold and thus do not produce any output.
That is the material and our methods. The experiments were exactly copied, and that is the gratitude to Professor Brunelli that he allowed to copy his experimental setup that has been done. The study has been approved by the annual research committees of both universities, and the program were applied to 30 female sparkle normal rats, as you can see here. And we had 3 branches in a double-blind prospective control study.
And what happened in the spinal cord immediately reflects up in the supraspinal connections and even down. So this is also another problem we have to deal with. We have to reorganize the brain again after the treatment.
We're going to start this last session of the afternoon. This is a short presentation of Marjorie Association, which is an institute for research on the human medical genetics. It deals with the diagnosis and research on rare genetic disorders. Marjorie started collaborating with on the amyotrophic lateral sclerosis in collaboration with Dr. Mazzini on the research side, and Dr. Banfi also on the rehabilitation side. And then Marjorie organized this afternoon session, gathering researchers in this field, amyotrophic lateral sclerosis, clinical and genetic aspects, and also on the care of this disorder.
You can see the main principles of stem cell therapy in the central nervous system, and the main concerns are about the administration route that can be directly in the parenchyma or maybe systemic or even intracerebroventricular.
In the last 12-15 years, more than $500 million have been spent to find a treatment for ALS. Many drugs have been tested. Just one was introduced in the market with poor clinical effect, which is all.
The familial cases, the disease segregate according mainly to dominant inheritance, and the discovery of a lot of different loci, even in a very small number of families, underscored a very strong genetic heterogeneity.